equally as disturbing is Ebola. We haven't mentioned this at all on the program this week, but we have the world's worst known outbreak of Ebola virus in West African nations. And you wanted to talk about this because you were like, you didn't think that we were doing enough really to in this regard in terms of national policy. Do tell.
Yeah. Well, I want to talk about it because I think it's important, what it says about us. I think it's very easy for people to see, for us to have, to be told again and again about how bridges and roads are getting dangerously decrepit or falling apart. But it doesn't have that visceral, impact that Ebola has. And people dying. And the reason I bring that up is just because, and I bring up roads and bridges as only one of many parts of our infrastructure or the role that we believe government should play, which is actually protecting its people. And, it's Ebola, it's other diseases too, but basically there are a number of articles that have come out and have just said, and this reminds me of sort of unreinforced, if that's a word, levees and Katrina, being warned about that for years, being warned about Homeland Security for years and doing nothing. And in this particular case, we've been warned again and again, and we even had the incident of one of the Americans who died over there, got on a plane. Sometimes it takes 8 to 10 days for these symptoms to show, and you're contagious, and it's easily caught through any bodily fluid, including saliva. And so the gentleman, sadly, who died, got on an airplane from Liberia and ended up in Lagos, Nigeria, and died in the airport. Now, it seems at this point nobody else was infected there, but he was on his way to Minnesota. He, a few days later, was going to fly to Minneapolis to see his kids, for his daughters, which is obviously another kind of tragedy, for one of their birthday parties, and his wife. And I don't know how many people were going to be there, but perhaps enough that, who knows. So you'd think, in knowing that, we'd be doing something. And then I read this article, or a couple articles, one of them was in the Daily Mail, but in a few other places, that basically why, it's looking like it's going to take 2 to 6 years to have a vaccine. Why is that? Because there's no market for it. Because, of course, as we know, the market has taken over our lives. And we don't just do things because the government realizes that something could be a threat or a danger and they should protect us. We only do things now if there's a good market for it and farmer can make a lot of money. And obviously Ebola outbreaks are, only happen here and there, and it's usually among the poorest communities. So they're not interested, and that's exactly the kind of role in our society that we've reserved for government to step in and do something. And if they've already doing tests on animals that have shown some success, but they need to
human trials.
Yes, they need human trials. They need to speed it up. But guess what? They don't have the money for human trials. So we're not doing it right now. And that's why I wanted to talk about it. I mean, it's a terrible tragedy, obviously, for everyone in Africa. It is a horrible way to die. Everyone who's passed away over there, my condolences, and so I'm not trying to belittle that. I don't care what happened in Africa. I'm just saying I think there's a broader issue here.
Yeah, it's interesting. I think healthcare, and particularly the development of different drugs and of different healthcare technologies. And I remember having a conversation with someone who was developing, and for the life of me, I can't remember what it was they were developing, but they were going around, and they were VCs, and they said, we've come across some amazing technologies. We just couldn't figure out how to profit off it, and these things languish. And this is a perfect example. This sector is a perfect example of how the market does not solve these problems. And
That's
particularly, right. Now, by all accounts that I can read, because of we have things like running water,
right.
and we have a much greater ability to deal with a virus like Ebola, that it's not necessarily a huge threat in this country per se. But with that said, though, the NIH is been working with the FDA to put the vaccines that they have through these trials, like you say. But people forget the Schecter, which drastically defunded NIH, was not reversed. And so you have this absence of government spending here because, as it stands now, we haven't had that massive outbreak that is going to spread through tens of thousands of people. But it's not impossible to imagine. We're talking about, cases, the Ebola that has double, this outbreak is double the first outbreak, or the last outbreak, I should say. And this is a disease, or a virus, I should say, that we've only been aware of for about 30 years.
That's right.
And as there's more development in West Africa, you're going to start to see this virus travel more and more as more people move to the cities, and
right. And key
travel
thing, Sam,
becomes.
I don't mean to cut you up, but it had never made it in the past to an urban center before.
Yes.
And now it made its way to Freetown, where there were 1 million people, and made its way to Lagos. I haven't even looked up the population. I think there's probably a couple million people in Lagos, maybe more. And so, and we're talking about major hubs for with air travel. And so I'm not trying to cause any kind of a panic. You're right. Every analysis I've read says the chances of it getting over here, obviously, the conditions here are not conducive to an outbreak. But at the same time, when you find out somebody died in an airport and they could have been on their way to Minneapolis, I'm just saying, even while the chances aren't great, again, I think this is sort of one of those, teachable moments about here we know about something ahead of time. We've just had an outbreak in a part of Africa where it had not happened either before or in a long time. A much larger outbreak than before, an outbreak in urban areas than before. The first known case where somebody got on an airplane and made it to another large city before dying. It feels like, again, we don't do anything about things until they've already happened. And even if the chances aren't great, this seems to be a deadly enough disease. Usually it has a 90% mortality rate. This time right now it's at about 60%. But the people who are better, get better health care for obvious reasons, would be the ones more likely to survive. I mean, it's a very deadly virus, and it's a very terrible way to die, and you would think this isn't an enormous investment of money when you consider what we spend on airplanes that don't take off.
And indeed, and it's a perfect example of how neoliberalism, the idea that the market is always going to solve our problems, simply doesn't work in the context of public health, and be it global public health or domestic for that matter. And then the other irony, of course, is that this defunding is been a function of this neoliberal agenda, and certainly promulgated by the Republicans in this country. And the irony is, of course, is how much they've been trying to sort of say that these Central American kids who are coming in, I think some of them have been accused of bringing Ebola into this country.
I believe
which, of course,
Phil
is not
Gingrey,
true.
who's a Republican doctor.